Welcome everybody to the Wednesday webinar of FASD Hub Scotland, and the date is the 20th of April, and we're really excited to have with us Jennifer Shields from the Fetal Alcohol Advisory Support Team here in Scotland. Jennifer is our guest for this evening's Wednesday webinar. For anybody that's not joined us on a Wednesday webinar before, I just want to explain to you that we can't see you, we can't hear you, we don't know what's going on in your home this evening. So if you're still eating your tea or you're still putting little people to bed, your husband is or partner are enjoying a relaxation, then please don't worry, we can't see, hear any of what's going on. If you would like to ask any questions during this evening, please use the Q&A function, which you'll find at the bottom of your screen. If you're on a laptop, you'll find that directly at the bottom of your screen. If you're on another device, then that could be to the left or the top. And also please use the chat function just to say hi, let us know where you're from, which part of the country. I know that we've got people from Scotland, but also from other parts of the UK as well. Another member of my team, Barbara, is in the background, so if you've got any technical difficulties, please do use the chat function. She might be able to help you with those as well. This is being recorded and will be available on our YouTube channel after the event has taken place and once editing has been done. So without further ado, we'll get going. We're going to be chatting to Jen this evening about diagnosis and all things that involves. Thank you for all of those who have submitted some questions. We'll do our best to answer those. We are unfortunately unable to take specific individual questions. For obvious reasons, we can't answer those, but we will try and answer questions more generically and give as much information and signposting as we can. And throughout the evening, there will be useful links that will be shared through the chat, and those will be shared in the YouTube information that's put up later on. So I'm just going to share initially as well with you some information about what we've got going on in the hub coming up in weeks ahead. And I'll just do that with you now. You will see a little slide come up here. And we've got some great exciting events going on. So following this Wednesday webinar, next week we've got the Bite Size Cafe. This is a new initiative that we're doing for this year. It's once a month, and it's where you can grab your lunch, bring it along during a lunch hour, 1 hour session, opportunity to do some networking with other parents, carers and professionals, and hear a little bit about FASD and also the work of the hub. It's a free event. You just need to register through our Eventbrite page. Anybody living in the Greater Glasgow and Clyde area, we're really excited to be working with NHS Greater and Glasgow and Clyde. In partnership with them, we have a project starting this month, and on this Wednesday we have a special welcome event for all parents and carers who've got a young person, young adults, or child with prenatal alcohol history, and our new community support worker, Andy, is holding an event for you specifically on Wednesday, and again you can book for that through the Eventbrite page. We've got our next session of the What is FASD, which is going to be taking place on the 4th of May. And this is a free 3-hour training specifically looking at all different aspects of FASD. And this one is for parents and carers. And just promoting next month's Wednesday webinar, which is with the lovely Julie Otto, who wrote the book Instructions Not Supplied. She has is an adoptive parent of a young person with fetal alcohol spectrum disorder, and we will be talking to her on the Wednesday webinar in May. So lots happening and coming up, and if you'd like to take advantage of those things, then please do visit our Eventbrite page. So I will stop sharing that and return to Jen. Jen, thank you very much for joining us this evening. First of all, could you just tell us a little bit about who are you and what do you do within the FAST team?
Hi, so for those who haven't met me before, my name's Jennifer Shields. I'm a consultant clinical psychologist currently based in the Western Isles in CAMS, which is the Community Child and Adolescent Mental Health Service. I also work, as Aliy said, in the FAAST team, so it's the Fetal Alcohol Advisory and Support and Training team, and we've got quite a big name, and with that quite a big remit nationally in Scotland. We're based in the University of Edinburgh. We used to be based at NHS at Ayrshire Naran in Irvine. Ayrshire Central Hospital, people might know us from there, but we're currently in Edinburgh, and although geographically I'm in the Western Isles, we work together as part of a small team in partnership with FASD Hub Scotland, but the remit that we have is really focusing on professionals, particularly in health and social care, those involved in the neurodevelopmental assessment and support pathways and services for children, young people, and also adults who may be affected by prenatal alcohol exposure. So I guess I could speak a wee bit more about our team and our the details of what we do, but our overarching aims are to enhance the level of training that's out there for professionals, which hopefully will have a knock-on effect for service provision for families and those who are affected. We want to be able to offer consultation and support to clinicians who are beginning assessment and consultation themselves in health board areas across Scotland. And lastly, we are aware that there's a need for a lot of research and evidence base, somewhere that we can create a knowledge about what FASD in Scotland is like, and collect information so that we are building services the right way for those who we mean to serve. And we want to hear from people who those services are for in their co-creation. So in that, I mean, we want to hear the voices of those who are affected by FASD, their families and carers, to enable us to think about service development and how we best train clinicians. So there's a few strands to our bow. There's a lot that we are needing to do, but that's how we are hoping to move forward. And I'm happy to speak about any more of that in any more detail, but that's just the broad strokes of it at the minute.
Fantastic. So there's lots for us to unpick there this evening. So thinking about this evening's topic is around diagnosis in particular. I'm just thinking, you said that you're a clinical psychologist, and I know lots of our parents and carers will have heard of CAMS and probably heard of the title clinical psychologist. What do you actually do, and what would that mean if they were going to meet somebody who's a clinical psychologist in relation to an FASD diagnosis?
Okay, so it's quite a big question, but the answer that I usually give to the kids is that because sometimes kids hear this title clinical psychologist and it's quite an intimidating one.
Yeah.
I think for people to hear, and I sort of usually just say I'm a person who really likes to get to know other people, and in whatever way I can to support them with things that are a challenge to them, or words to that effect. And I suppose what my job is, in a nutshell, is getting to know the person, the people around them, the teams around them, in order to best understand, first of all, what are the problems, what's going on, what we call protective factors, what are all the positives that are going on for a child as well, because there are often strengths and things that they have as talents and hobbies that they enjoy, etc. So trying to understand what's the problem areas, what are the positives, where are they at just now, and then to try and better understand those areas, we look at sort of early development, all the factors that may have led to somebody being who they are and becoming who they are. We look at all the factors around them in the present moment that are affecting them and influencing them. So what's going on at school, what's going on in families, what are the current stressors perhaps, what are the things that help, and what we look to do is try and better understand so that we can build the right interventions and supports around that child and their family for those challenge areas. And we draw on our knowledge as trained psychologists and psychology and all the theories and things that we were taught in it's quite extensive training. So when you come and see a clinical psychologist, it's somebody who ought to be able to respond to the needs. But I have to say straight up, and I'm going to be really honest, in my training, I wasn't taught a lot about FASD, and I have to say there's a lot of clinical psychologists out there who may not have had that as part of their core training, and they've had to go and do additional training like I did in assessment and diagnosis, and are still developing their confidence in that area. So I guess that's where our team come in. So as a clinical psychologist, I only got to know about FASD in 2012, and I started training 5 years before that. And, so I just want to say, although we are taught a lot, we don't know it all. And a lot of the information that we need, we get from families who are the experts of their own experience and the experts in their own child. And we learn from them and become a member of the team around the child. So it's really a co-created, or it should be a co-created affair. It's not coming to us as the experts. We're a member of what's usually a multidisciplinary team, which means there's lots of different people with different skills and training, all working together to get the understanding of the child. And we can speak a wee bit more about that later. But in a nutshell, that's what a clinical psychologist does, is works alongside families and other people to get that understanding right and therefore get the interventions right. I hope that's an okay explanation.
Yeah, I think that's a great explanation. I love the idea that you are a person that loves getting to know people, and I think that I can certainly of you, Jen, I could say that is definitely who you are, having known you for a few years now, and you're definitely somebody that likes to get to know people and understand who they are. And certainly, as a parent and carer myself, those of us with lived experience, yes, we are experts by experience, and it is our children who enable us to be those experts. Mm-hmm. I think I've written a blog recently where I talked about my son being my teacher. He's the person that's, been my greatest teacher in FASD. Had other great teachers, including yourself, but certainly he's been my greatest teacher. So yeah, definitely it needs to be a whole team approach. So if we sort of think about the whole diagnostic experience for a family, and we've been sharing on Twitter recently how somebody might go around. Barbara's just sharing there if anybody wants to read that blog. If we've been sharing on Twitter recently how people might go about getting a diagnosis, so I thought that might be a good place for us to start this evening. Mm-hmm. Around FASD. So if we could just talk about in the pathway and how SIGN would go about doing that. And there's obviously a really great handbook that's been produced by SIGN for parents and carers that I believe did have input from yourselves and also from those with lived experience in developing the creation of that handbook. So could you just describe for the viewers the process that in an ideal world should be there for somebody who felt that prenatal alcohol exposure had a feature in their young person's life and they were wanting to explore that? Okay,
so in an ideal world is what I'll describe, but I'd like to reassure people that it's been a long-standing commitment of our team and the individuals that we work in partnership with to try and help services develop into that ideal world. And what I'm going to describe isn't just in my mind as a dream. It was in my mind as a dream several years ago, but we've been working really hard in what might seem like the background because people aren't seeing change yet. I think I'm fair to say in a lot of health board areas, people are waiting to see change. And I suppose that's because in the background, we've been working at a national level. I suppose the reason for that is so that there isn't a postcode lottery about service provision. And that ideal service or idea for that ideal service has now been put to paper and is there in black and white, committed by the Scottish Government as they're not just their dream for service development, it's what's going to be happening. It's a programme of work that has been agreed at government level by a lot of people who have consulted very widely with lots of other people about how this can happen. So I want to say that what I'm about to describe is the dream, but it is going to be the reality because of a lot of work that's been put in by lots of people in what's called the Neurodevelopmental Assessment Pathway. And this pathway isn't going to just be for CAM services, so for kids that have got a mental health difficulty and who are in that service. This pathway is going to be, and to use the words of the gentleman who had a massive remit in writing this, a no wrong door approach. And people listening to this might be like, really? I've chapped on several already. We're moving towards there being a way of coming in, a single point of entry into this system, if you like, that will ultimately get you to the neurodevelopmental team. That team isn't any longer just going to be committed to investigating or wondering about things like autism, people may have heard about more often than FASD, despite FASD being more common than autism. It's not going to just be looking at ADHD, which is the other one that people ordinarily used to have referrals for. It's not just going to look at certain conditions, it's going to look at the child's neurodevelopment, no matter what the question is about it. If there are concerns that are shared by the family and maybe by other people, and there's some evidence to show that there are clinical concerns, and what I mean by that is there's significant difficulties in a couple of areas or a few areas, then you should be able to access an assessment team, so not just a clinical psychologist, but experts in, say, speech and language therapy, experts in motor and sensory development, experts in so medics, pediatricians who can look at genetics. So for the whole spectrum, if you like, of neurodevelopmental conditions, there is going to be a team who will assess and look at the strengths, look at the difficulties, work out what that looks like, and if there are diagnostic explanations, so if there is a diagnosis to be discussed, or diagnoses as the case may be, lots of these things overlap, then that team will be equipped to have those discussions. And this is the dream bit, because these teams are new, they're going to take time to get up and running in order to be able to assess for that wider range of neurodevelopmental presentations and conditions, FASD being one of them. So at the minute, that team would probably be very confident in an assessment for autism and ADHD. They might be quite confident even in learning disability. They might be confident in what people might know as dyspraxia, or, all these kind of more, not common, because they're not more common than FASD, but they're commonly spoken about and they've been much more commonly taught about. So these neurodevelopmental pathways are now going to be a feature of every health board in Scotland. The paper's online, people can Google Scottish Government Neurodevelopmental Pathway and have a read of this paper themselves. Myself, my colleague Sarah Brown and various other colleagues took part in writing this paper and we made sure that FASD was talked about throughout this process. They consulted with ourselves, which was very gratefully received, and our voices were heard, but we were channeling the voices of the people that we have met over the years, of Aliy, of all the families, of the people affected by FASD, to make sure that this service would be something that they would benefit from. So that is the dream, but it's also going to be the reality, but it's going to take time to train all of these people to the point where that referral for FASD, or a referral for difficulties that people then realise could be FASD, are adequately assessed for and supported. And we need to support the clinicians' development, which is why our team exists. So I'll maybe stop there, Aliy, and let you sort of maybe digest a bit of what I've said, because I've said a lot, and maybe we can speak in detail about some particular parts of that. But that is what's going to be happening in Scotland, and it is in progress now. It's not in 10 years' time. It's something that we're working towards now.
Absolutely, thank you. So the neurodevelopmental pathway, a link to that's just been shared in the chat for anybody that would like to look that up, you can do that. And you're right, I know that there are, I believe it's 3, if not 4, so it's 4 sites, I think, for adult services and 3 for children and young people that are piloting in Scotland at the moment, this move to that full neurodevelopmental team. And I think that as a parent and carer myself, that's an exciting prospect. Maybe there is some frustration out there. I know that we see that within our community. And I see there's a question there about, as a parent and carer, how best can we work with professionals to support our children, especially where, I'll just get the end of that question.
I can see it.
Where we have to deal with old system rather than the improved neurodevelopmental pathway.
Yeah, and I suppose that links to the question that I suppose I've probably not addressed, is how it links with SIGN. So SIGN stands for the Scottish Intercollegiate Guidance Network, which is a very cumbersome term for, I guess, the people who give us the guidance, the best practice guidance, I should say, around certain conditions. So there was one for autism that I worked on many years ago, and more recently was invited to join the SIGN guideline for children and young people prenatally exposed to alcohol. That's the term for it. And that guidance, to answer Sarah's question, sets out what is the gold standard for FASD assessments, and there's a parent carer guide where it's all sort of digested down as well, which has been usefully distributed by Barbara here. I suppose where the tricky bit is that although there's that guidance there for clinicians, they are still putting that into practice. So being able to point clinicians to it, they should know that that is there. Also being able to support clinicians to know about our team. So sometimes the clinicians don't realise that they can approach our team for actual on the ground practical guidance and support. I would even discuss cases with them and support them in their confidence around assessment and diagnosis, or that's what our team is there for. We've went and met up online during COVID, particularly to support health boards like Orkney, Western Isles, albeit not pilot neurodevelopmental pathway areas, Lanarkshire, Grampian, to name but a few. So all these health boards are really trying to get their ducks in a row to be able to do this. It's just that people have maybe not gotten to the point where they feel confident in it. And it's like where autism was 20 years ago. And there's been a lot of investment thrown at autism in the last 2 decades to get people to where they are now. It's taken a lot to get people as confident as they are now with autism. And I'm afraid it's similar for FASD. But when they contact us as a team, we can reassure them that they have the skills, they've got the knowledge, and for the bits that are FASD specific, we can support them through that. So if there are areas that are feeling like, do you know what, we're not sure if we can do this, we're able to be alongside, and obviously we work in partnership with yourselves, Aliy, with the hub. From the parent carer perspective, we can join together and help support those networks as we try and improve things more strategically across the board. So for those individual cases, that's maybe what we can do to help support.
Yeah, and I think we've worked with the FAST team this year, so we've developed what we've called our tear and share. So within that, there's it's an A4 leaflet. There's information that we can share with parents, and on that, you can literally tear off a corner that you could take and give to your clinician, and it's got the information on there about the FAST team, as Jen's just said, that it gives them the details of how to contact the team, how to, their website, their contact details. So you could take that and you could have that conversation with them at the next clinical appointment, as a real practical solution to how to work with them, how to have that conversation, how to bridge that gap. Because it is about, relationships at the end of the day, isn't it? It's about building bridges. And it's not about making walls. So Barbara's just shared a couple of links to the SIGN guidelines and also to the FAST team. I don't know if Barbara shared it earlier, but if she could share the handbook as well, that would be really useful for parents, I think. So I'm just looking at some of the questions that we had that were submitted earlier, Jen. So we had, I think the first question here was around Yeah, well, there's a question here which is about what support is there after diagnosis. I think maybe we'll come to that afterwards, actually. So there's a question around training for doctors in Scotland, which you did sort of touch on, but I just wondered if you could expand on that a little bit. You talked about how the FAST team have got responsibility for training and delivering training for clinical colleagues throughout Scotland. Could you just expand on how you do that, or how you will be doing that in the next kind of period of time?
Yeah, absolutely. So historically, there's been lots and lots of training on raising awareness of FASD, and I know that jointly we do that, Aliy, across the board for all agencies. And we also have run now 3 diagnostic events. So we've trained maybe 120, 80, and then another 80 clinicians on FASD diagnosis in the context of Scotland. So there were clinicians who came along for maybe 3-4 days to have that and absorb that knowledge. But I guess translating that into practice, we found, was tricky for people when they didn't have that ongoing support network. Our team didn't have the resources to be able to do that on such a mass scale, which is why we've reconfigured, moved to the university. And we're in the process of developing not only courses around FASD awareness and diagnosis, but specific modules for specific disciplines. So like, for example, you said they're medics, for doctors to come along and do online learning in their own time, e-learning, to be able to use sort of case studies that we have made, not about a particular person, but just to allow them to put that into practice and gain confidence in it. And then we're also going to be setting up monthly support networks for professionals to bring any sort of tricky areas or stumbling blocks in terms of FASD practice in their area. So up until now, there has been hardly anything for clinicians bar a one-stop training event, which, as we know, does not change practice on the ground. We can't expect people to just go and just run with it in an area that is very new to them. So, and I understand that people will be sort of listening and thinking quite rightly about how frustrating it is to try and access a service in their area that people don't seem to know what to do and aren't doing what they should be doing as per the signed guideline. And I'm not saying that I want to excuse that being the status quo. I guess what I'm trying to do is explain the barriers that have been reported to us from clinicians' points of view about why it's been hard to affect change in their practice in their local area. Because it's not just them, it's a whole team, it's whole systems, and it's a very I think FASD is a complex area of work, to be fair. I think people do need to feel confident to do it. So they might have the knowledge, they might have the skills, but the confidence is needing to come through us building that, through resources, through online training materials, through understanding how to change practice on the ground. And now that all these neurodevelopmental pathways are going to pop up all over the place, we've got the framework, we've got the people, we just need to get the training delivered and that confidence up so that when families arrive, they say, yes, we can do that. This is how we're going to do it. And these are the tools of the trade that we've got, because ultimately, families know that and have reported to us that the diagnosis is helpful to them, the understanding, having an ability to say this is what it is, but also the profile of strengths and challenges or strengths and difficulties that comes with that. So that neurodevelopmental team, all those brilliant people with all their skills, assessing the language, the memory, the sensory, the neuropsychology, so all the bits of the brain. So it's like the departments of the brain all get put through their paces, and you can see where the child is doing well, but you can see where they're struggling, and then you know how to intervene and what to do. So all those cogs in the machine are needing to come together in an FASD lens and to confidently understand these children and communicate that profile to the children, the young people, and the adults and families. It's a lot of complex work, but we're really trying hard to get people up to speed. And we've now got the signed guideline. England has just published their NICE guideline. I know it's 2022, right? And ours was in 2019. It's decades too late. But we're trying and we're getting somewhere, I think, now. And see, to put it in international context as well, just so people might feel a degree of hope in what I'm saying. Scotland has chosen a very brave path of making sure that every health board will have a free pathway that every child that there has concerns can access. It's very aspirational, it's very ambitious, I know, but that's what they've chosen to do, and the government have endorsed it and are facilitating that. And FASD is going to be included in all of these pathways. I'm not sure there are any countries in the world where that is the case. They've got specialist centres where it's really hard to get into, and only a very small percentage of the population get anywhere near those doors, and they have to pay. And very little people come out, from the bunch of people that are affected by prenatal alcohol exposure, very little people come out with a diagnosis and a profile. They might have one or t'other. As a very small country, we're really trying hard to make sure people come out with a very meaningful profile of understanding their child and a diagnosis if appropriate, and that they can get that wherever they live without having to travel miles and miles and go on planes and trains and automobiles and go to a place that's foreign to their child for a day or two, to a specialist centre that they waited 4 or 5 years to get into. I know the waits are happening just now, but the change is afoot, and the teams are in place now, ourselves, yourselves, and all of the others that we work alongside to try and make this change happen. It's I can only apologise to people for their frustration and waiting, and that it's taken so long for things to get to even where they are now. But I just want to reassure folk that lots is happening behind the scenes. I hope the papers that we've been sharing will help people to see that, and that they will have a service to access at some point. I'm waiting for the questions coming about the adults though, so maybe we'll sort of address that soon, Aliy.
Yeah, there aren't any right now, but I think we'll get to them in a minute. I think I just wanted to pick up on the NICE quality standards. I see somebody is putting about NICE is only quality standards, it's not equivalent to a guideline. And I think it would just be good to acknowledge that NICE have taken on the sign, as you said, but there is a difference between a quality standard and a guideline. We have guidance, but as you say, we've now also got the Neurodevelopmental Pathway, and if that is implemented across Scotland in the way that it should be, and the way that you've described, then that would be phenomenal. And I think the thing is, the key to all of that is going to be the timeliness of it, isn't it? How long it takes for that to happen.
Can I just say to Melissa, I think it was Melissa Baker that said NICE are only quality standards, it's not a guideline. The quality standard actually is stronger than a guideline. The quality standard for NICE carries more weight than the sign guideline, would you believe? And the reason being, the quality standard is something that the commissioners in England need to report on and need to actively think about their service development in relation to it. It's a standard that needs to be met. Our guideline is simply a guideline. It doesn't say that clinicians must do it. But so in England, it actually carries more weight. And the fact that they've adopted the sign guideline in a way helps us to strengthen our argument, because then we say, oh, we've got a guideline. And also in Scotland, we do use NICE. We read up NICE documents and we refer to them in our reports as clinicians. We actually look at both. And in England, they've been looking at ours too. It's a sort of dual thing, but the NICE one carries more weight. Just to reassure you, I know that maybe things are a bit further behind than in Scotland, but I reckon in England, the pace of change is probably going to need to be faster than what ours has been, because it is a quality standard, just to clarify that. Yeah,
and I think having been part of the round table, I would agree. And for anybody that hasn't been able to access it, then it would be worth looking. If you are in England, at the Time Is Now report as well, which I think Barbara will probably share the link to that as well, which came out of the there was a round table of 9 round tables that took place from December to March, and there was a big report that came out and was published in March as a result of those. Barbara's just sharing it now. definitely, you know, there's I think huge leaps have been made. If I look back to 2018, which I think is when I very first met Jen at a conference back in Edinburgh, where Sarah and Jen came and spoke. That was the very first time I think I met Jen, and we had Raja Mukherjee and Lee Harvey Heath and several other people speaking, and massive things have happened in Scotland since then, and it is frustrating for the FASD community, but you know, big things are happening, and I think when we look back in another 5 years' time, you know, then I'm sure we will be much further down the path than we are already, and that is, you know, that can be very frustrating as a parent when you've got a 9-10-year-old in front of you and you're thinking, well, they'll be 15, they'll be 16, they'll be at the end of education at that point. That is frustrating. But we need to try and look at the positives as well and think of all of the things that we can do, and how as parents we can parent differently. We can parent through a neurobehavioral lens, we can parent through an FASD lens, we can understand about you know, looking through thinking differently, change our expectations, scaffold, look at the strengths, you know, understand the differences, understand, you know, that the can't, not, won't, etc. So by doing all of those things, we don't have to wait for a diagnosis to do any of that. All of that is going to support, and even if they never got a diagnosis, we're still going to be supporting our young people.
And what's really nice now that we're all in existence in terms of these organisations, yourselves at the Hub, ourselves at FAAST, is that we are now getting invites from all over Scotland, universities, like today, for example, from Edinburgh University, one of the courses there want our team to go and lecture as part of their programme so that their trainees come out knowing about FASD, and then we're getting invited back to speak more. So like the neuropsychology courses across the country now ask us to come and present on FASD. So it's a huge, seismic change from 10 years ago. There was no training for, well, there was an organisation in Scotland that were doing training, forgive me, trying to get professionals involved, but the actual Scottish Government invite to clinicians to go to a formal diagnostic training that, you know, involved flying a whole team of folk over from Canada to train us, that was 10 years ago. 10 years ago this November that people were formally trained in diagnosis in this country for the first time, really. And on that scale, there might have been 1 or 2 or 3 people, paediatricians, who'd went off and learned somewhere. But a lot has changed. I think in the last 5 years, I'd agree, Aliy, the pace of change has really sped up, and I think it's just going to keep going like that. So what has seemed a really long glacial pace, I should say, for families, it's not like that anymore. And I just wanted to reassure people that behind the scenes, lots is changing quite rapidly, and all these teams trying their best to work through FASD queries and cases is, you know, it's great. It's great to hear. And as a team, we are actively supporting that work. But maybe, you know, now that we're just getting ourselves established in the university, we're going to be doing a lot of work to try and publicise that and bring people in our door and get those events attended to. So yeah, it's going to change.
Yeah, I agree. I think we're seeing, you know, we've been doing some work with the children's here in Scotland, and we've helped them to have a whole kind of, they have an online training system for all of their panelists. I think that's like 8,000 people across Scotland, something like that. It's a huge number of people that work on their panels, and they now have a whole set of tools around FASD, so just completely didn't exist before. So that's a huge number of people working on children's hearing panels that now will have understanding about fetal alcohol spectrum disorder that didn't previously. So, you know, there's a huge amount of work going on, as you say. So I guess we should talk about the part of that we hadn't touched on, but you raised it, which was around adult services, and what's been happening there.
So in adult services, it's a case of neurodevelopmental pathways in general are agreed to be needed beyond child and adolescence. In adulthood, people discover that they have neurodivergent needs as well. So the neurodiversity movement is where we agree that everybody is different, and we've all got our strengths and difficulties. When somebody's neurodivergent, it means, you know, they've got a reason to maybe warrant assessment and consideration of interventions for additional support needs. And in adults, that exists. A lot of the time people are in mental health services as adults is because they have been misunderstood for so long, they have struggled for so long that their mental health has been compromised. And they are in a mental health service possibly still being misunderstood as having a personality disorder or having whatever else. And there's also the forensic service where people can be because they haven't had the support to not be there. And so these adult services are very quickly looking, that they're learning from what's happening in child neurodevelopmental pathways. I'm delighted to hear that one of the Scottish Government teams are now piloting some autism and ADHD neurodevelopmental work in adult services. I can only see that lifespan approach will start to develop, and that people will be looking at more than just autism and ADHD, particularly once we get our resources, not just for diagnosis, but for professionals to do the diagnosis ready. Our team are already looking across the lifespan. We're not just developing resources for professionals that work in child and adolescent services. So we're future-proofing everything that we're doing. And there are already adult clinicians who are expressing an interest and who have come along to training. In fact, Susanna Rourke, who's in our team from the forensic service, came along to one of our What is FASD information sessions at Pullman many years ago, sat in the audience, and I saw her face and knew what her face was communicating to me. And since then, she came along to her diagnostic training with other adult colleagues, and she's now part of our team, and the adult colleagues are also out there trying to change practice in their services. So it is a slower process in adult, but I just want people to know that that hasn't been overlooked, and that there are other clinicians who don't necessarily work in FASD, but who might be very experienced in autism, for example, who are very keen to ensure that neurodevelopment in adult services is something that's considered. So we're on it. It's going to take time, but all our suite of resources and training will be as applicable to adult services as it will be child.
Yeah, I know, and I think as well it's worth saying that as children become adults, don't they? So exactly. As children get a diagnosis, they don't lose that diagnosis just because they become an adult. Yeah. So in a sense that as an individual gets diagnosed, more and more individuals get diagnosed. I guess that's what I'm saying. As more children get diagnosed, they become adults. So therefore it's going to force services, because there will be care plans and those things, and they've got to be lifelong. So, you know, that's going to force services are going to have to, you know, do something.
Yeah. And even if an adult hasn't been able to access a pathway of assessment diagnosis, for example, we collectively, all the organisations in Scotland who do this, to do FASD awareness, have trained now thousands of people on the ground, who then speak to other people who haven't been trained in it to alert them that, oh, this could be FASD. Those conversations didn't happen much in the past, but now they're happening more and more. And because of the hub and ourselves and various other organisations, there's a whole raft of resources that you can read that might be about children and young people, but you can read that from the point of view of an adult as well. It talks about the brain domains, it talks about all the interventions, very applicable across the lifespan. So there are now resources, regardless of whether there's a diagnosis or not, that might help people make sense of what is coming to them in terms of a presenting problem in adult service. But it's a brain-based presenting issue. It's not about behaviour. It's not just about mental health. And people are now wondering, is this about neurodevelopment? Is this a feature of neurodiversity? It's a language that's now being spoken more and more. So I do feel like adult clinicians are coming along with that conversation. It's just about change on the ground in terms of practice that's going to take time. But like I say, that's why our team are here, and we're going to work our socks off to do what we can.
And at FASD Hub Scotland, we're well, we're delighted, I guess that's the word, to have a really small group, and it is a small group of adults with FASD, and they're an amazing small group, but we'd be really happy to have more people join that group and help us develop some of those resources that we've got already, and make them more applicable to what FASD means when you're an adult as well. So if you are an adult and you're listening to this and that's appropriate for you, then please do get in touch with us. And we're really pleased that we've had a few adults recently get in touch, and our focus for FASD month this year will be FASD Hear Me, which is all about the voice of the individual. So just to plug in there. We've got a couple of two really specific questions, and one of them is around the neurodevelopmental approach. It sounds really positive. This person's asking, though, what about waiting lists in CAMS? Obviously, that's been massively impacted by COVID. We're all, I'm sure, those of us that have got any involvement with CAMS will be really aware of that. A really specific question about a particular area where there's a 2 or 3 year waiting list. The question is, what's being done to address this? And I don't know. I do know the answer to that, but I don't know whether you do specifically.
So maybe we can both put what we know together, because I think that's it's a really big question that the government have acknowledged that there's a lot of barriers to getting a service in CAMS. The waiting lists are lengthy in many geographical areas, and that pre-existed COVID, and COVID just you know what COVID did. We don't need to linger on that anymore, but there are government monies that were released to specifically address the waits for neurodevelopment, and I've heard of very creative ways that health boards are using those monies. It's very recent in terms of service speak, release of those monies to then translate into new people on the ground with the knowledge and abilities to do what needs to be done. Lots of very creative ways to address waiting lists, and it's an ongoing challenge that's it's going to take a long time. And I think that's where, the ambition of having such a wide open door to all children coming in with neurodivergent needs has to be realised. And the government have got their plans and their vision for how they're going to upskill and increase the capacity in services. But none of these remedies are going to be quick. Mind you, that I have heard of a few very creative ways that the health boards are using their monies. So maybe I shouldn't say that, but I'm a realist as well as being an optimist. It is going to take time, because these assessments don't get done in a couple of hours. Certainly not, the ones where maybe FASD is questioned. They take a bit of time, and they take several people being involved with the child. So it's something it's taking too long, but once you get that service, it's worth its weight in gold what you can learn from it. But yeah, Aliy, I'm curious about what you might know as well, and whether we can.
I was going to say the same thing. It was about funding had been made available to enable the reduction of wait lists and wait times. And specifically within this area, this question was asked about. I'm aware that a meeting was on earlier today that had been acknowledged. So, yeah, I think, but I think, as you said, it's not going to be a quick turnaround.
No. I mean, our team, just to give a wee example, our team have been working with people. So the developmental history is a big part of the assessment, and we've been working with people who are designing developmental histories to be given out to families so that they can, fill in and complete as much as they can and bring it into the service. So that frees up lots of time for the clinician, for the service. Families get to do it in the privacy of their own home, and if they do need support to complete it, there's clinicians ready and available to do that. So we're trying our best not only to work with the services around the processes, but actually the tools of the trade. We're trying our best to sort of collaborate and help people who've got great ideas around changing some of the tools that we use and making things more efficient and effective. So it's not just training and that kind of support we're giving. We're trying to give as much practical support in terms of what assessments to use that are quicker, what ones can be more effective and more efficient, and when to use them. So again, that's where we would like people to come to us and discuss these things. And we usually do it as a big group for health boards, not just one clinician, because there's usually 10 people asking the same question. So yeah, but it's a really difficult area, and COVID has just made it so difficult. It really did get in the way for 2 years.
Yeah, definitely. So I've got the next question is, given that the NICE the FASD is now in England and Wales, will there be any changes in Scotland's approach to aid paediatricians' decisions-making process? Currently, it seems to be hit and miss, dependent on the individual and their interpretation of the guidance. I think we've kind of addressed that, but
yeah, there's also, maybe I should say extra, that there's been sort of outreach to paediatrician events, so like their CPD, their continuous professional development event. So the Royal College of Pediatrics had a conference, and we went along and taught 80 paediatricians about FASD, about how to do the assessment, alongside paediatricians who are very skilled in doing it. And I know that was just repeated as well. So we're going out to profession-specific events in order to maximise the ability to channel FASD knowledge. So we're not only just waiting on people coming to us, we go to them. And that includes GPs. We've developed an e-learning module for GPs now on FASD. So if people are seeking a referral and you feel that the GP is sitting going, well, it's not an area that I know a lot about, you can say, well, there's an e-learning module for GPs on that. And we are happy to help GPs upskill themselves in that. So yeah, the medical side is like all the professions is an area that we need to focus on, and we're going to be building a sort of module specifically for medics to access. I think I mentioned that earlier, so I hope it's useful just to repeat that and to talk a bit about the e-learning that's out there for medics as well.
Mm-hmm. Okay, great, thank you. Somebody's asking about, is it possible to ask where you are on the waiting list? I'm assuming that's in relation to CAMS, and I think, yeah, you could just make a call to your local CAMS and just make that question, that request. I'm sure they would answer you. I don't think there's anything wrong with doing that as the parents. Quite reasonable. Somebody asking about what do you do as a first step towards getting your child assessed? If it's completely and utterly the very first thing, we would say approach your GP. Is probably the first place to go, or you could go via school, but generally we would suggest approach your GP, ask for a referral to paediatrician, usually community peds, ask for somebody who's got an interest in neurodevelopmental, or ask for an expert in FASD if there is one in your area, but ideally somebody that's got an interest in neurodevelopmental as a first port of call.
Yeah, it's useful to be quite clear about the reasons why you're asking for a neurodevelopmental assessment. So what are the areas of concern? Having a bit of detail around, say, concerns around motor skills, but what examples would you have? Maybe write those down. So like tying shoelaces by, whatever age you would expect that to be, beginning, but it's been a long-standing issue, not being able to like use cutlery, just examples of the motor, the sensory, the memory, the language difficulties, having that detail there for either as Aliy said, the education lead, somebody who's in the team around the child. So it could be someone in education, it could be the GP, can then contact say either CAMS or community paediatrics and say, these are the concerns that I'm hearing about. There is a history of alcohol exposure. It's useful to try and get information on that, or to be able to be explicit about where that information could be, or that it's a suspicion. That's okay to just say it's just suspected, because somebody else might do a bit more digging further down the line. And assessment around that, there's various ways that we can try and assess for alcohol exposure using facial features, for example. But I think the important thing is to have the examples of the difficulties, and those should also include emotion dysregulation, any sort of mental health difficulties, difficulties in controlling behaviour and impulses and attention. Try and be as explicit as possible about why it is you want a neurodevelopmental assessment, and that there may or may not be thoughts about FASD and why that is and what information you have about that, so that the referrer can send as much information and know where to send the referral, because the GP might choose CAMS, they might choose paediatrics depending on what you bring, and it just saves you going to the wrong service, you know, when more information becomes evident. So it's useful, as Ali's saying, just to kind of go along, maybe have written some notes, and yeah, you can access, you know, resources while you're waiting on a service as well. It's not a case of, you know, you can't get any help or support until something is done at the other end. It's about connecting with the FASD community as well, to hear about what other people find helpful while you wait on a service. But that is probably the best ways of going around getting a service quicker, is having that information in a more detailed way, because a lot of the referrals that are received can be quite scant on details. So that's just a practical recommendation.
I should have said that you can contact our helpline and they can help you put together that kind of detail. So we are coming up with a kind of template through our collective lived experience to help people create those notes for themselves, so that they can take that along to their GP as a first point of call. But if you contact our helpline, then our helpline advisor can kind of work that through with you, or through our parent partners. So that's our family support one-to-one service, which is free of charge for anybody living in Scotland. Again, our parent partners can work with you just to help you put that together, so that when you go, you feel fully prepared and you've kind of thought through all of those things. And that can be something that could just take, you know, 2 or 3 calls. It doesn't have to be a long drawn out process, but we've got that support there and available for people. So, you know, use our service. That's what it's there for. Great. So we've got I'm just looking at time, so we've got kind of 2 minutes left, and I know that we've got 2 other questions. I'm just wondering if we can really quickly just cover those off. I think there's one other question actually. Will there be e-learning modules available for social workers and social care professionals? Good question.
Yes, there
we
will.
are. That was quick.
In progress.
Within our 1 minute. Well, thank you so much, Jen, for joining us this evening on the Wednesday webinar. Thank you for everybody that came and asked the questions. I hope that you found this useful and helpful. Thank you very much for Barbara for sharing all of the links within the chat, and thank you for everybody that's engaged in the chat as well that's been going on. I've seen a couple of questions and a couple of comments there as well from people, so thank you very much. It's been really great having Jen with us, and just ask her to stay as people say goodnight. Thank you for joining us. This is the end of the Wednesday webinar. As I said, this recording will be available on our YouTube channel once it's been edited, and we will see you next month for our Wednesday webinar with Julie Otto.